Good morning, and thank you very much. I want to thank Dr. Khanna and Mr. Henri and all the people who have organized this very excellent symposium. I think a testimony to the success of any program is the fact that the enrollees or attendees increase every year rather than decrease. And it would appear from the numbers that Dr. Khanna mentioned this morning that the number of fellows attending is up now at least 20 or 30 from last year, which I think is excellent and shows that the program is moving forward very, very properly. The purpose of ISIS, which is the International Society of Endovascular Specialists, an organization which is open to not only surgeons but cardiologists, interventional radiologists, vascular medicine people, is its main purpose is education. And that's why actually Dr. Bousquet and I are here, why Mr. Henri is here, why Professor Benjoulin is here. We believe in education on an international scale. And what we like to do is participate in educational programs for fellows and for people who do the actual care of patients at the local level. We think it's very important that we try to disseminate knowledge among all of our countries to the best that we can and try to bring the whole spectrum of vascular disease to the forefront so that people understand that the same problems exist in India that exist in the United States, that exist in Europe, and exist in Asia with some variation. And that's really the purpose and why I think it's important for you, especially the fellows, to consider membership in ISIS, because it is an organization dedicated to continuing education. And that, I think, is probably, as you well know, the most important thing that you can possess. It's the one thing no one can take from you. Education belongs to you, and your ability to help disseminate that to others is also a gift. So we hope that you'll become interested in ISIS. We're represented in, I think, some 66 countries now around the world and have some 1,600 members. And we have a wonderful journal, the Journal of Endovascular Therapy, which is a magnificent journal, probably second only to the Journal of Vascular Surgery in terms of impact in the vascular field. With that, I would like to introduce Dr. Jacques Bousquet, who is the roving ambassador for IVUS. He was the president last year, and he did such a great job that we've kept him on to be the ambassador to go to various meetings and organizations, speak in behalf of ISIS. And I think Jacques will give you a little history of ISIS, which will be very helpful to you to understand how the organization works. And again, thank you, Dr. Khanna, for the kind invitation to come back again this year. I look forward to an excellent meeting. Your meeting last year was spectacular. Thank you.